The meeting at the airport's Wessex lounge was well attended, and although it threatened to boil over into pockets of moderate chaos at times, the tone was respectful, positive and engaging. Questions were asked on issues such as appointments, tinnitus clinics, chemotherapy, staff complements and the complaints procedure. Dr. Geoghegan acknowledged the service's imperfections and failings, but his focus was on plans for improvement. He said 30,000 calls were made to the PCC every month, and most people called at the same time, first thing in the morning. He said reorganizing the appointment system so that this didn't happen would free up that bottleneck.
So we hope that new system is going to be up and running by mid-June. We're also going to start using technology in that we will be texting you your blood results. Why do you have to ring in to find out, have you got my blood results? Is there something wrong? Back in the UK, for years we've been doing this. So we will text you your results. If you have an appointment, we remind you of your appointment so you don't forget about your appointment. So we're going to get far more into day-to-day technology, not the kind of highfalutin stuff that frightens people, but simple things on your phone that you all use on a day-to-day basis.
At accident and emergency, non-urgent cases will be triaged and referred to primary care, with an online live stream of current waiting times informing patients how long they're likely to take to see a doctor if they attend.
We have GPs who work in our PCC late into the evening till about 8 o'clock. Well, if we're busy over in A&E, why aren't we triaging those patients, assessing those patients and saying, oh, hello, Mrs. Jones, like another person I saw last week. I said, what's wrong? They said, I haven't pain in the shoulder. When did it happen? 2 weeks ago. Now, I didn't think they needed to be in A&E, but they wanted to be seen by someone. So we'll have triage nurses working in there who will triage you going in and say, you know what, let's get you over here to primary care and get you seen quickly. Because if you're here, we're having emergencies, you won't be seen for X amount of hours.
2 new ambulances will be delivered in September and a third next year, with smaller ambulance cars and mopeds for paramedics being considered. The GHA will also shift itself away from the hospital and into the community, with mobile health teams carrying out services such as blood pressure checks.